Everybody talks about trauma-informed care and trauma-informed practices, but the reality is our bodies hold our stories. And if our bodies can't feel safe, then our minds can't feel safe. Our lower brains take over, we're in survival mode. And when you don't have adequate transportation, adequate education, adequate health care, that's where our mental health anchors are. How are we learning? How are we healthy? And how are we connected? So if we don't have those pieces in place, if we don't have a way to help people, then our minds are occupied with how am I going to get through day to day, as opposed to looking at how can I think about the future in a meaningful way. At Bread of Healing, we intentionally create presence. So we are here, we are available, we don't have barriers to access. Being a free clinic, we don't have to worry about billing health insurances, we don't have to worry about electronic health records, we don't have to worry about those things. We are just able to meet the person truly where they're at. As a free clinic, being able to have access to counseling services is fundamental. Relationships are how we connect. Relationships are how we heal. Our primary counseling staff are interns from local universities, master's level interns. They can be counseling interns or social work interns typically. And because every year we change our interns, a client sometimes will have an opportunity to work with an intern for a full year, and if they decide to continue services, they'll work with a new intern the following year. But what's really exciting about that is the continuity in the relationship that they have with counseling services in general.
I have to say my therapists who have helped me with my mental health journey, because they're students who are working on their PhD, so every year it's a brand new person. And while that can, I think to some, feel overwhelming to retell my story, I have learned that it's a fresh start every year for me to set new goals on what I really want to work on.
The Milwaukee Healthcare Partnership has heard from our members and our partners and community organizations that mental health and mental health care access is one of the #1 community health issue areas that we can come together around to address. So we have partnered with United Way to focus on a mental health improvement fund. And this fund is designed for people of all ages in multiple settings. So it really is a very comprehensive set of priorities that we're going to focus on.
I truly feel that Bread of Healing has saved my life. I mean, there have been times when I've been really, really low, and the support that I get here is, now that I have a full-time job, the support here still from Bread of Healing is better than what I get through my full-time insurance. Like, I wish I could come back and get the services from Bread of Healing.
We know that we have people that have not just individual traumas, but we look at the whole community as trauma affected, trauma impacted, and we look for ways to help support people in the healing journey. In our community, there's not a lot of open doors. At Bread of Healing, we have an open door. We don't screen out people, we screen in people.